Upstate University Hospital putting itself and its patients in an incredible position.
Upstate earning the highest honor a facility can receive for its nursing care. Joining us now is Chief Nursing Officer Scott Jessie. First, congratulations to you and your team.
Thank you so much.
An honor.
We are very excited.
So I'm curious what goes into earning magnet recognition. That's what it's called, especially in the industry. Like, who determines what hospitals get it? How do you reach that level?
Absolutely. It is a process for sure. So Magnet's been around since the late 1990s. It is a program run by the American Nurses Credentialing Center, which is actually part of the American Nurses Association. Okay. Nationally, there's about 650 Magnet hospitals. That includes the United States and a few international sites. It's about 10% of the hospitals in our country are Magnet. In New York State, there are 54, and in Central New York, there are one, and that is awesome. We are very proud of that.
Yeah,
well, Scott, what do you think puts you in the position, your team, in the position to receive this kind of recognition?
Yeah. Well, there isn't just one thing. I really think it is about the culture of what we do, how we build our nursing program, how we support our teams. The process for submitting for Magnet is rather laborious. It's a 3,000-page document, honestly.
Wow.
For our redesignation. And it covers a 4-year time period.
Okay.
So it looks at all sorts of things, from nursing quality outcomes, patient care, patient satisfaction, staff satisfaction, how the nurses work across the organization and collaborate with other disciplines. So it's very holistic and all-encompassing when you look at it from that perspective. And we take great pride in the culture we build and the kind of environment we are building for our nursing team. We want to build a place that nurses want to work. Healthcare is a tough job. Yeah. Building an environment where nurses thrive, where they feel empowered, where they feel like they have a say in what they can do is a big deal for us. One of the key components that we invest heavily in is shared governance, which allows our staff at the front lines, the people doing the hands-on care, to make a difference and make decisions about how they deliver the care, what the protocols and practices are, and improve things along the way without a lot of interference from other parts of the organization. So that's really important to us.
You mentioned kind of hands-on, that bedside kind of care. I mean, how much does this Magnet recognition go beyond that? What I think people traditionally think of, that's a nursing care, that's nurses.
Well, it definitely looks at that traditional component, right? Like the hands-on care at the bedside or at the clinic when you go to a doctor's appointment. It 100% looks at that. But it also, because it is that holistic approach, it looks at how does nursing drive quality initiatives? How is nursing innovating, implementing new things, bringing new equipment and resources and ways to deliver care into the system? How do we work with the many amazing healthcare partners we have to deliver top-notch care across the region? It looks at how we empower our teams. It's just so holistic in terms of all-encompassing approach, and nursing is so much more than just the bedside care now. It looks at our leadership team, our nursing environment, and how the organization as a whole is committed to supporting the nursing team. And we're very lucky at Upstate that Upstate is very committed to nursing.
Well, Scott, we want to point out this isn't a first for your Upstate team. This is the second time. First time was in 2021. So what do you think that says about Upstate's nursing team?
I think it says a lot. During our first go-around, it was during the peak of the pandemic, which was exceptionally difficult. But boy, were we excited and proud when we got that first designation. The last 4.5–5 years of healthcare hasn't really been a whole lot easier in reality. There's been a lot of ups and downs. It's been quite difficult. So to me, this redesignation shows our commitment to excellence, commitment to our nurses, our patients, our teams, how we care for each other, how we care for the system, how we care for the region. It shows that we're consistent and we maintain that level of excellence despite those hardships and difficulties.
Time for maybe one last one I want to get in here. I mean, we talked a lot, an incredible honor again for you, your team, everybody at Upstate, etc. What does it mean for the patients themselves and their families to say, like, I'm at a hospital that's gotten this kind of recognition, which is quite rigorous, as you explained, in earning that? They don't just give that out to anybody. So for patients and families, what's it mean?
I think it means a lot. For patients and families, for sure, it means safer care, better outcomes, a team that's truly committed to their well-being, to patient and family-centered care, and they're getting care from top-tier nurses recognized as some of the best in the nation. I think that speaks volumes to our region. I also think it means that they're going to get trusted care providers that they can rely on and depend on, who are there for their benefit. Remember, nursing has actually been the most trusted profession in America for 23 years in a row. We are super proud of that. We're proud to be committed to delivering on that promise and providing care to our people.
All right, now you've got the recognition to go behind that as well.
It's wonderful.
Yeah, Scott, thank you so much for joining us today.
Absolutely. Thanks for having me.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.